This is the recording for Chapter 14, Endocrine System. The endocrine system and the nervous system work together and strive for homeostasis. And if you remember from Chapter 4, or maybe it was 3, we talked about homeostasis being the state of equilibrium within the body with adequate water, acidity, and temperature of the cells. So the endocrine and the nervous system have to balance that state of homeostasis for the body. The pituitary gland is a rather peculiar gland to me. It is the size of a pea. It's very tiny. It's located at the base of the brain, and it's known as the master gland. That particular pituitary gland, that tiny little gland, is the reason why it's called the master gland is because it tells all of the other glandular secreting organs how much and when to secrete what they secrete. And so if you look in your book on page 462, it shows all the different things that the pituitary gland has control over. So for a male, it has the control over the testicles for the stimulation of the hormones, the ovaries for the female, same thing. Prolactin, which is a hormone for females, to the mammary glands, oxytocin to the uterus, ADH to the kidneys, growth hormones to the bones, ACTH to the adrenal cortex, and the TSH, which is the thyroid stimulating hormone, to the thyroid gland. So little teeny tiny, I think of it as like a microcomputer that is constantly at the switch of how much hormone to secrete and when to secrete it. The thyroid gland is located in the neck just below the larynx then, and its function is to produce T3 and T4 to regulate the metabolism and the energy level. And if you look on page 461, they show the thyroid gland is number 2. So you see it right to the lateral sides of the trachea. And so the thyroid gland is responsible for metabolism, like keeping our metabolic rate where it should be, and we know as we get older the metabolic rate slows. Also, the hormones are responsible for our energy level. So when the hormones are not enough where they need to be, then we start to have some deficits and some problems that we'll talk about in a little bit. The pancreas then, you can see on page 461 is number 5. It consists of a group of cells called the islets of Langerhans, and it lies inferior, which means below the stomach, and in the bend of the duodenum, or the duodenum, which is part of the small intestine. The function of the pancreas is to produce enzymes and digestive secretions. Most notably, it produces the hormone insulin. And insulin is used by the body to lower the blood sugar. And also, the pancreas produces glucagons to raise the blood sugar. Pathology that we see of the endocrine system: when there is over or underproduction of the hormones, when the pituitary gland is not keeping things in that homeostatic balance, we have hyposecretion if the gland is not secreting enough, and so that is treated by supplemental drug hormone therapy. So for instance, a patient has hypothyroidism, so we supplement that with thyroid stimulating hormone in pill form. Hypersecretion then is the excessive production of the hormones, and so that can be treated by surgery, sometimes to surgically remove the gland or partially remove the gland. And there's some different types of treatments that are used for hypersecretion. It's not always just surgery. Pituitary disorders generally lead to growth, body size abnormalities. So with this gentleman here, he has hyperpituitarism, and this gentleman has hypopituitarism. And then this is a man of normal stature, just to use to show the difference in the height of these patients. Thyroid disorder symptoms: patients that have hyperthyroidism can develop abnormal weight loss, excessive perspiration, muscle weakness, emotional instability, really emotional, like sensitive. a condition called exophthalmos, and this is what this lady is exhibiting here. Exophthalmos is protrusion of the eyes from the sockets due to hyperthyroidism or a goiter, Graves' disease type problem, and that is enlarged thyroid gland as well. Treatment for the hyperthyroidism is drug therapy to block the TSH production. So we give medications so that it suppresses the thyroid from making more hormone, or we can do surgical removal of the thyroid, or a treatment called iodine ablation, which will help to reduce the amount of thyroid that the gland is secreting. Graves' disease or toxic goiter is hyperthyroidism to the nth degree, and so this is a huge thyroid gland. This is very atypical. You don't see this walking around very often. And so hyperthyroidism is from excessive secretion of T3 and T4, which are those thyroid hormones that are excreted by the thyroid gland. Then if the thyroid gland is not secreting enough thyroid hormone, there's, depending on what age, person, or patient this develops in, if hypothyroidism develops in an infant, it's given the term cretinism. And if it happens in an adult, it is called myxedema or hypothyroidism. Most of the time in practice, or in my experience in the practice that I worked in, you didn't see the hypothyroidism called myxedema. It was just called hypothyroidism. But basically, these patients have edema or swelling in their lower extremities. They will begin to gain weight because their thyroid gland is controlling the metabolism and it's slowing down the metabolism. They have quite a bit of fatigue and sluggishness. They may have hair loss and patches that fall out of their hair, and they typically have or complain of dry skin. Acromegaly is not all that common, but megaly means enlargement and acro means extremities. So that's exactly what it is, enlargement of the extremities. So you see in this patient, he has abnormally large hands. And along with that, they have a very broad forehead and an elongated jaw. Disorders of the adrenal cortex. Cushing's syndrome is one that's caused by hypersecretion of the adrenal cortex or excessive administration of cortisone. Patients with Cushing's syndrome will have symptoms of a moon-shaped face and neck, purple striae on the skin, which are the purple stretch marks that you see on pregnant females when they gain a lot of weight rapidly. They have fatigue, hypertension, which is high blood pressure if you remember, and they also have a condition called hirsutism, which is male pattern hair growth in a female. So here is a patient who is a female with Cushing's syndrome. So you can see she has the moon-shaped face and the neck. Then she has the male pattern hair growth across the upper lip and the chin region. We can't see her abdomen, but she probably has the purple striae on the skin as well. Pancreatic disorders, when we think of the pancreas not working, we think typically the patient has diabetes. So there is a difference. There's type 1 diabetes and type 2 diabetes. Type 1 diabetes is abbreviated IDDM, and that stands for insulin-dependent diabetes mellitus. This type of diabetes we see most often occurring in children and adolescents. These type of patients require daily insulin injections or they will die. Their pancreas is not making enough insulin, so the blood sugar is circulating at a very high rate, or high levels, I should say, and without daily insulin injections, they will go into a diabetic coma and die. Type 2 diabetes, then, is the more common of the types of diabetes, and it's considered non-insulin dependent diabetes mellitus. This typically occurs later in life as patients begin to become a little bit more overweight. Risk factors obviously are a family history of diabetes, and obesity is a leading factor to adult type 2 diabetes. Treatment for type 2 diabetes, weight reduction makes a significant change or benefits significantly for a type 2 diabetic, because if they have excessive amount of fat in their body, sometimes the pancreas is making enough insulin, but the insulin is being held hostage by the fat cells and it can't do its job. So if we see a significant weight reduction in an obese patient, many times that will correct the diabetes. Also, diet modification, obviously, and restricting their caloric intake, and then medications if they are of normal weight and diet alone does not control their blood sugar. So diabetes can cause hyperglycemia. If you break this term down, emia means blood condition, hyper means excessive, and glyx means sugar or sweetness. So this is high sugar levels in the blood. These patients will then develop glycosuria, which is sugar in the urine. That's never a normal finding for a patient. And what happens is the body's trying to get rid of the sugar any way that it can. And so what it does is it makes us thirsty, which is called polydipsia. Poly meaning many or much, dipsia meaning thirst. So if we get very thirsty, then we're going to drink more. If we drink more, we're going to urinate or micturate more. And so the body's going to dump that sugar into the urine. And that's how diabetics can have problems with their kidneys, because our body was not made to filter sugar through the kidneys. And so that's how they can end up on dialysis if they have uncontrolled diabetes. They also will have a condition called polyphagia. Again, poly means much or many, and phagia means eating, so they have increased hunger. Because as the blood sugar starts to drop down to normal levels, they will feel a little bit weak and shaky, like their blood sugar is going low. So they eat more, so that raises the blood sugar back up. Gestational diabetes, then, is a form of diabetes that only occurs when a female is pregnant. The mystery to gestational diabetes is once the child is born, most likely the patient will then no longer be diabetic. However, they will be more predisposed to diabetes later in life, and especially if they have family history, and also if they are obese or overweight. Hope on the horizon. As of February 20th, 2008, which has been several years now, there were researchers making stem cells that secrete insulin. And so in these mice, they were testing and transplanting cells to try to regenerate basically pancreatic cells that could secrete insulin. And they were able to do this with mice, but obviously in a mouse and doing it in a human are two different things. And the amount of FDA red tape that has to be cleared in order to arrive at a procedure or a drug in order to do this is quite extensive, and so I haven't seen anything much since that time. Oncology. Pancreatic cancer is a cancer that is a bad diagnosis to have. Most patients, once they're diagnosed, usually the longevity of their life is about 6 months from the time of diagnosis. Very poor survival rate, 2% survival for 5 years. Now, there are some patients who outlive that statistic, but when they study across the board, usually from diagnosis to death is 6 months. There is no known cure for pancreatic cancer. There are treatments for it, but that only prolongs life, and sometimes the quality of life is poor at that time. Pituitary tumors are generally not malignant tumors. Symptoms can include headache, blurred vision, personality change, dementia, which is cognitive impairment, or a seizure. Thyroid cancer begins as a painless hard nodule adjacent to the lymph nodes with an enlarged thyroid gland. The mysterious thing about thyroid cancer is where it develops, it can cause either hypothyroidism, meaning not secreting enough thyroid, or too much thyroid stimulating hormone. Obesity can be an endocrine problem. There are two forms of obesity. There is exogenous obesity, which occurs from excessive intake of food. So this comes from the outside. Exo means outside. So these patients are consuming large amounts of calories and are not getting or are not burning enough calories, so the extra calories are stored as fat. endogenous obesity, then, endo means within, inside or within. So this is a metabolic or an endocrine abnormality that causes obesity, which cannot necessarily be controlled by the patient. We probably all know someone who is grossly overweight and they eat like a bird and they're still overweight. And so this type of obesity comes from a metabolic or endocrine abnormality that's not keeping the body in a homeostatic state. Diseases and conditions you need to know from page 479. Acromegaly, we already talked about, and I showed you a picture of a man with acromegaly, which is extremity enlargement. It's a very rare hormonal disorder in adulthood. Promotes soft tissue and bones of the face, hands, and feet to grow larger than normal. The term glycosuria, I talked about briefly, was abnormal amount of glucose in the urine. Hirsutism, we talked about that with the Cushing syndrome, is excessive distribution of body hair, especially in women. And obesity, which we just talked about, is an excessive accumulation of fat that exceeds the body's skeletal and physical standards. Medical, surgical, and diagnostic procedures to know. First one starts on page 482, thyroidectomy. You can break this term down. Ectomy means surgical removal, and thyroid is the thyroid gland. Fasting blood sugar, or glucose, is a test that measures the amount of glucose in our blood by drawing a blood sample after fasting for a prescribed amount of time, usually 8 to 12 hours. And then a glucose tolerance test, or GTT, is a test that's done to determine if a patient's diabetic. And so what they do is they administer a prescribed amount of glucose drink for the patient. And then at 1, 2, and 3 hour intervals, they will draw another sample of blood from the patient. And with a normal pancreas excreting the insulin, we should see an initial spike in the blood sugar. And then as the first hour goes on, you'll start to see the blood sugar come down. At hour 2, down a little bit lower. And after 3 hours, a blood sugar should be back to normal. So if a patient is diabetic, we're going to see that blood sugar spike, and then the blood sugar may come down some, but it's not going to return to normal in the 3 hour period that it should. This is a test that we can sometimes catch diabetics, because sometimes diabetic patients can have a normal fasting blood sugar, but the blood sugar goes high after they eat. And so this is kind of where we can catch some of those diabetics. Abbreviations to know for the quiz, page 485, you need to know DM for diabetes mellitus, TFT for thyroid function test, TSH for thyroid stimulating hormone. And then the next 3 abbreviations are not in your book, but you do need to know them because we're going to see them continued on charts. IDDM, which means insulin-dependent diabetes mellitus, NIDDM, which means non-insulin-dependent diabetes mellitus, and BMI, which stands for body mass index. Again, you're responsible for memorizing the word elements. This is where you're going to make your flashcards for those combining forms, prefixes, and suffixes between pages 470 and 472. Here ends the recording for Chapter 4, Endocrine System.